Good day everyone, I am Angel Subalvaro, a student nurse from LPUSC School of Health Sciences Inc. Today I will be performing 3 physical examinations, including inspection, indirect percussion, and auscultation. So let's begin with the first one, which is inspection. So what is inspection? Inspection is a technique that we use to observe and detect any normal or abnormal findings through the senses of our vision, smell, and hearing. Now, this technique starts from the moment we meet our clients and is continuous throughout the examination. Note that other techniques such as palpation, percussion, and auscultation can alter body appearances, hence inspection always comes first. Now, as we practice inspection and collecting objective data, we are guided by the following guidelines. Okay, so as we enter the room, we need to make sure that the room is at a comfortable temperature. So we have to adjust the temperature of the room. This is because a too hot or a too cold room temperature can affect the normal behavior of our clients as well as the appearance of their skin. Another thing to remember is that we need to use good lighting, preferably the sunlight. This is because fluorescent lights can alter the true color of the skin. In addition, in dim light, some abnormalities may be overlooked. Now, before we proceed to inspection, we need to make sure that we sanitize our hands. And after we do this, we can now begin our physical assessment. Okay, so now we can conduct the first physical assessment, which is inspection. First thing that we have to do is we have to introduce ourselves. Good day, ma'am. I am Angel Subalvaro, a student nurse from LPUSC School of Health Sciences Inc. May you please verify your name and the date of your birth for me, please?
I'm Jane Rhea Subalvaro, May 21, 1990.
Okay. Ms. Jane, I am going to conduct a physical assessment known as inspection. If you have any questions for me, you can just ask me throughout the examinations, okay? Okay, so the next thing that we need to do is to compare the symmetry of each of the body parts. We first start with the eyes. Ms. Jane, can you please follow this pen? I will move it towards you and away from you. Just follow it. Can you please follow my finger? Test your peripheral vision, so you can tell me now if you can see my middle fingers. Okay, that's good. So after the eyes, we now proceed to the ears. So I will first check if the ears are symmetrical. We are going to perform a whisper challenge, so I need you to cover your other ear and I'm going to whisper something and you're going to tell me what is the word. Check. Other side, please. Okay, good. Okay, so now we proceed to the hands. First, I'm going to check if the hands are symmetrical. Will you please give your hands to me? Now we're going to check for capillary refill. Also for edema in the hand. So after that, we now proceed to the arms. So first, I'm going to check if the arms are symmetrical. Can you please raise your arms for me like this? And then like this, sidewards, please. If I push you, you need to resist. Go, resist. Other side, please. Resist my push. Go. Other side, please. Then we are gonna perform the sharp and dull test. So I have my pick here. This one would be the dull and this one would be the sharp. Okay, so I need you to close your eyes and tell me if you feel this would be dull and this would be sharp. Now we are going to proceed to the lower limbs. I need you to resist again for me, please. Go. Side. Go resist, please. Side, please. After this, we are going to again perform the sharp and dull test. Close your eyes, please. Now. After that, we are now going to look if the legs are symmetrical. And we are also going to check for edema in the legs. Now let us move on to indirect percussion. What is indirect percussion? Indirect percussion is also called as immediate percussion, and this is the most commonly used method of percussion. The tapping done with this type of percussion varies with the density of the underlying structure. Now, as the density increases, the sound or the tone becomes quieter. For solid tissue, we can hear a soft tune. For fluid, we can hear a loud tone. And for air, we can hear an even louder tone. Now, these tones are referred to as percussion notes, and they're classified based on 4 factors. Number 1 would be origin, number 2 would be quality, number 3 would be intensity, and number 4 would be pitch. Now let me demonstrate how to conduct indirect percussion and how to develop proficiency in using this technique. So now we are going to proceed to indirect percussion. So the first thing that we need to do is to expose the body surface that we are going to percuss. And then we want to place our middle finger to the skin of our patient. Make sure to lift all the other fingers. And then with the use of our middle finger from our dominant hand, we need to tap twice, okay, to listen to the percussion notes. You have to do like that and then that. So I also want to demonstrate how to percuss the abdomen. So we need to expose again the body surface if we are going to percuss. And with the use of our non-dominant hand, place the middle finger into the skin. Make sure that your 4 other fingers are lifted. With the use of your dominant hand, the middle finger, we need to tap twice. Okay. And now we move on to auscultation. What is auscultation? Auscultation is a technique that requires the use of a stethoscope to listen for heart sounds, for lung sounds, for bowel sounds, and for the movement of blood throughout your cardiovascular system. Now, why use the stethoscope? The reason for that is because some of these sounds are not audible to our ears, and only with the use of our stethoscope that we can listen to them. Now, there are a few things to remember before and while doing auscultation. First, you need to eliminate all distracting noises such as radios, televisions, and etc. Second would be to warm the diaphragm of your stethoscope as well as the bell of your stethoscope before placing it into the client's skin. Remember to not put too much pressure while using the bell, as this might act as the diaphragm of your stethoscope. Third would be to expose the body surface that you are auscultating. You need to remember to avoid listening through clothing, as this might obscure or alter the sounds you are listening for. And lastly, while performing auscultation, you need to explain to the patient the sound that you are listening for, and you also need to be ready to answer their questions to alleviate their anxiety. So now we are going to proceed with the proper use of a stethoscope. So we need to put the earpiece in our ears, angle it toward our nose, and use the diaphragm to listen for heart sound, lung sounds. So I'm going to use the diaphragm to listen for the heart sounds. So we have to make sure not to listen to clothing, as this may alter the sound that we are listening for. So we just have to listen here. Now we use the bell of our stethoscope to listen for heart murmurs. So you want to like. So as you do this with your bell, make sure not to apply too much pressure, as this may act as a diaphragm of your stethoscope. And that's it. That is how we properly use the stethoscope.